Broadcasting live from the Business RadioX studios in Atlanta, Georgia, it's time for Atlanta Business Radio. Brought to you by OnPay. Built in Atlanta, OnPay is the top-rated payroll and HR software anywhere. Get 1 month free at onpay.com. Now, here's your host.
Lee Cantor here, another episode of Atlanta Business Radio, and this is going to be a good one. But before we get started, I'd like to thank our sponsor, OnPay. So please support them so we can continue to share these stories. Today on Atlanta Business Radio, we have Bill Nordmark, and he is with Aver. Welcome.
Thank you, Lee, very much.
Well, Bill, before we get too far into things, tell us about Aver. What are you doing, and how are you serving folks?
Well, thank you. Aver is a young technology company. We are here to revolutionize healthcare, to help insurance companies and doctors build models that bring value-based care to the market and drive value for patients. If I could give you an example of kind of what happens today in healthcare, I'd show you kind of an experience of an airline. When you buy an airline ticket, you don't get a bunch of bills when you land. You buy it up front. We're bringing the same to healthcare to end the way the difficult billing practices and confusing patient experience is resolved.
And then is this a response to kind of the new rules of the game where at one point they were just charging for services? It didn't matter if it worked or not. And then they just keep kind of more charging. And now they're trying to put a stop to that.
Well, that's correct. So for the longest time, the healthcare industry has been in what's called fee for service, which is, basically the quantity or volume of services that one undertakes is how they get paid for. That's unlike any other industry. Healthcare is the only industry that does that. What we're bringing to the market is a model to bring value and move towards paying for outcomes, lowering cost, increasing quality, driving a better patient experience with price transparency so that patients know exactly what procedures cost when they undertake the decision to make those procedures, and that doctors get paid for positive outcomes versus volume.
Now, any type of disruption, usually the people who prefer the status quo aren't necessarily open to this. How difficult is it for you to kind of communicate this to your prospective clients that this is going to be better for them in the long run?
Well, over the past 10 years with the Obamacare legislation, there has been a move towards what's called value-based healthcare. You've seen that with trying to push new models into the healthcare industry. The biggest challenge has been that there hasn't been a technology platform that could facilitate this move. And so more than being only a disruptor of the model, we are an enabler to allow insurance companies and doctors and hospitals actually make this a reality. Until Aver came along, the industry has been saddled with siloed technology, siloed systems, and antiquated business rules that don't allow the systems to open up and make this value-based care a reality. So we see ourselves as an enabling technology. We see ourselves as a bridge to where healthcare needs to go. And so instead of being an adversary to the market while we're disrupting, being an enabler does bring about the change the healthcare systems need. So building solid relationships between insurance companies and the provider doctor community has been a staple of what we've been able to accomplish. And therefore, we're seeing significant traction today.
Now, are your clients the insurance folks, or are they kind of the practitioners?
A little bit of both. Our main target market is working with insurance companies to implement these programs. But like any business, similar to, credit card businesses, for example, like say MasterCard or Visa, where Their customers might be banks, but the end customer is the person carrying around the credit card that has the MasterCard logo. Our organizations are insurance companies who are our target customers, but by default, the people who gain value from the work we do with insurance companies are the doctors and the patients that get to take advantage of these programs. So we sell to insurance companies, but we spend a lot of time making sure that providers and patients can access these programs through our insurance company relationships.
So now, with the pandemic happening right now, how do you see the healthcare industry changing?
Well, the industry is going to change in a couple ways. Obviously, you're seeing programs like telemedicine and other types of digital capabilities come into the forefront. So there will be a digital transformation that is being accelerated by COVID-19. I think the other thing that you're also going to see is costs have to be lowered. And so you're going to see a huge advancement in changing how the delivery model works. And that delivery model change to move towards things like telemedicine and moving away from in-person visits is going to be provided through changing how the supply chain works, which is what we're doing. So people are tired of increasing cost. People are tired of continued increases in premiums. Employer groups need to offer lower healthcare, lower cost healthcare, better quality healthcare. And so we're going to see a rapid move over the next 5 years towards implementing a much more outcomes value-based model where people are going to, pay for value versus paying for quantity. And that's a huge step forward that the industry has been trying to push, but COVID-19 is going to be an accelerant for.
Now, do you think that because of the kind of shelter in place and the social distancing that's happening now, that people are embracing this telemedicine, whereas before maybe they would go to their doctor, they would go to even just for something small, like to get checked out briefly so you can get a prescription filled. Now they're kind of realizing, I could have done this, over the phone or on a video call. I didn't have to, spend 2 hours waiting for the doctor, getting in there for 5 minutes and then getting the prescription. Like, are you finding that people are doing telemedicine, or are they open to that? That way it's forcing them almost to do it.
They're definitely been forced to do it. I believe that telemedicine will play a huge role going forward in healthcare. Will everything move to a digital visit? The answer is no. I think the one thing about healthcare that people tend to forget is that, healthcare is delivered regionally, and quite frankly, it's local. So, many patients, especially, elderly populations, seeing their physician is a very important thing to make sure they're healthy. I can, remember my grandparents, and my parents, for that matter, are friends with their physicians, and that visit is, a moment to connect and make sure they're healthy. You lose that over a telemedicine visit. So I think, like anything in life, everything has its place. I think you're going to see a significant advancement in, using items like telemedicine, but I still think you can't replace, that connection with your physician to make sure that, when they see you and they're going to prescribe medicine and you need care, that still hand touch is critical. What I do think is going to change drastically, and you mentioned that you had somebody from Clearwave on the other day, is how doctors' offices work. we all have the experience of going in and filling out the clipboard with the information you just filled out, a month ago. It hasn't changed. And I know I've had a couple of visits to the physician, here during COVID-19, and that whole model is completely changed into maybe sitting in my car until my appointment's ready and going in and not waiting at all. So I think what COVID-19 is doing is a lot of these changes, like telemedicine, have been there for a while. People have been talking about them. It's not like they were not known, but I think COVID-19 is going to be an accelerant to make those changes happen faster. And we're seeing that in our business with this move for value. People can no longer continue to have 10 to 20% increases in healthcare costs year over year. And it's becoming a competitive disadvantages for companies. And that value has to change. So people need to start getting value out of the system versus, the system ultimately increasing cost on the individuals.
So let's talk a little bit about you leading this organization during this difficult time. How has it been as a CEO? Did you have to make any changes when we were kind of on lockdown, or was your company already kind of prepared to be working remotely? How has that experience been for you?
Well, there's a personal aspect to it, and then there's a company aspect to it. I think, as a CEO, you're the leader of your business, and how you react and how you lead are by example. We're a young tech company, right? So our whole infrastructure is cloud-based. We, other than our office, we can really pick up and work from anywhere. The main thing has been how do you continue to keep your staff healthy? How do you keep your staff empowered? And how do you keep them excited about the business and connected in a work from home world? So, we are a business where, our staff is young, lots of parents. I'm a father of a 6-year-old and a 4-year-old. We're a 2 working parent household. So I'm an example of, most of my employees. And when schools were let out, we had to do what was right to make sure our families were taken care of, and our employees are our family. So we quickly mobilized to a work from home environment. We've done 3 critical things in getting this transition moved forward. We started our every Monday with a 9 a.m. kickoff call to get everybody on by Zoom. We talked about what the upcoming week had in store for us. We talked about what the previous week results had been. We spent some time chit-chatting to keep that connectivity. We also did, a happy hour type Zoom once a week to just get connected. And then we instituted a new program, which is What's Not Working. So we had a Zoom call weekly where initially it was, what's not working with work from home and sharing best practices. What it's turned into is now people are sharing what's not working in our company. And so now as we wrestle with, do we go back in a social distance manner with half our employees, potentially not being able to go back because of constraints in our office, we're now looking at, our level of productivity. And I spend a lot of my time just making sure my staff is healthy, happy, safe, and connected to each other until we can get back in the office.
Now, has there been any learnings that because of the circumstance forced you to do things the way you're doing them now? Is there anything you're like, we'd never thought of this before. Maybe we can implement this going forward once we get back to some semblance of normal?
Yeah, we've had a ton of that. I think the meeting that we have where this concept of what's not working, we really started that because, nobody knew what this I mean, we've always had some people that work from home here or there, but moving to a completely remote environment, it started out as, hey, what's not working with working from home? Like, your technology, your laptop connectivity, all this. It's now morphed into, business challenges that are making us better daily. So items like that, started out as something simple and now have become fabric of the business. Our Monday calls, we weren't doing Monday calls. We just show up every Monday, like everybody, and grab some coffee and dive right into work. And our employees love the Monday calls now to get the week kicked off. So those are things that we realize. I also think we've learned an appreciation for what's important to spend time on and what's not important to spend time on. And work-life balance. I think if this has taught everybody anything, is that, work-life balance is important. And not only is it important for personal aspects, but it's important for business. And if you can get away from the company for a little while, if you can get away from the day-to-day grind and let your mind kind of release, you're actually more invigorated to come back and sharper as an employee than you are if you're in it, just constantly. So all of those items are, things that we kind of knew, but, really doing them now, through this work from home situation are things we'll probably continue.
So now, what do you need more of right now? Do you need more relationships with insurance providers? You need more relationships with medical practitioners? How can we help?
Well, we're looking for three things. Number one, we're looking to tell our story. We're looking to educate the market on that the changes in healthcare. Healthcare is an industry that has to change from the inside out. And so, the shiny bells and whistles of technology, the shiny bells and whistles of, different types of marketing speak, are probably not going to, move the needle as far as we need. So the first thing we're trying to do is get our message out about just how value-based care and this move to value-based care and transparency and lowering costs for better quality and how that's done. Educating the market that this is, possible and how it's done and how healthcare has to change from the inside out, like we talked about on this call, is job number one, evangelizing that this is possible. Job number two is insurance companies, and, getting more insurance companies to adopt these capabilities, which then enables the market to tap into those. And allow the providers, the physicians and the patients to be able to take advantage of these new models. And then third is to continue to break down the silos of the technology. There's so much technology out there and so much new technology that's brought to healthcare. But if it's not interoperable, meaning if it can't talk to each other, if, systems are still siloed, data is not shared, then you get just point solutions that are not connected and don't further, moving the industry to, achieve its goals. So those are the three items that, myself as a CEO advocate for all the time. And we advocate for our customers, and, we're saving some real dollars. We have insurance companies that are using our tool that are saving patients 20 to 30% on procedures, and it's real dollars that go back into their pocket. So we're excited to mainly tell our story and bring more to the fold.
So if somebody wanted to learn more, what's the website?
Our website is www.aver.io. And that's where they can find us. And then obviously on a lot of stuff posted on LinkedIn about what we're doing in the market, at our Aver Inc. LinkedIn page.
Good stuff. Well, thank you so much for sharing your story today, Bill.
I appreciate it, Lee. Thank you for having me.
All right. This is Lee Cantor. We'll see you all next time on Atlanta Business Radio. And remember, we could not be doing this work without the support of our sponsor, OnPay. So please support them so we can continue to share these important stories.
Today's episode of Atlanta Business Radio is brought to you by OnPay. Built in Atlanta, OnPay is the top-rated payroll and HR software anywhere. Get 1 month free at onpay.com.